Welcome to Tobacco Talk, the show that educates you on issues involving tobacco. Hi everyone, and welcome to Tobacco Talk, the show that educates you on tobacco use. On today's show, we have a very special guest. We have Claire Harvey, who works for the Toronto Public Health, and she will be discussing on how you can protect yourself on secondhand smoke. So welcome to the show, Claire. Very nice to have you here. So can you tell us about yourself and how you work for the Toronto Public Health?
Sure. I'm a health promotion consultant at Toronto Public Health, and I work in chronic disease and injury prevention, specifically in the field of tobacco control.
So just to make it clear to the audience, what is secondhand smoking?
Secondhand smoke is the smoke that comes off the end of a cigarette, as well as the smoke that someone exhales after they've inhaled it into their lungs, into the air. And it's got about 7,000 chemicals in it, over 60 of which are known to cause cancer. So it's very dangerous. There is no safe level of secondhand smoke.
So how does secondhand smoke affect you in comparison to actually smoking?
Well, some studies show that it's actually worse because smokers who are also being exposed to secondhand smoke, smokers have a filter. So that might protect them from some of the chemicals. Not a lot, but some of the chemicals. But secondhand smoke raises your risk of heart disease and cancers, and for young infants, sudden infant death syndrome, for children, chronic ear infections, pneumonia, bronchitis. So it's very scary.
So it's actually worse, as you said, than actually smoking.
Depending on levels of exposure.
Yes. So outside in public places, a lot of people can see there's the no smoke sign in workplaces and public places like parks or anywhere else in restaurants. Are there rules on private residences?
No. Well, actually, yes. The Smoke-Free Ontario Act, which is Ontario legislation, protects people that live in multi-unit buildings, so condos, apartment buildings, co-ops, from exposure in common areas. So that would be stairwells, laundry rooms, elevators. So there are rules around that from the Ontario Smoke-Free Ontario Act. However, unless a building itself wants to put a no smoking policy in place, there is no law that states that you can't smoke in your own private unit.
Wow. So for the people like me who live in multi-unit dwellings, or MUD as you would like to call it, some of the obvious places where smoke can travel through are doorways and cracks. Are there other places that people might not know of?
Oh yes,
like sneaky places?
There are sneaky places. There's no such thing as an airtight building, and nor should there be. People share air. Good air circulation is part of being in a healthy building. Electrical sockets.
Really?
It goes into the wall. Shared electrical panels, ventilation, so heating vents. I'm trying to think what else. Flooring, ductwork.
Wow.
Yeah, it sneaks, it travels, smoke travels. Someone once compared it to having a no peeing section of the pool. Once the pool has been peed in, it moves. It won't stay in one place. So yeah, it knows how to travel.
Very, very sneaky. When I was younger, I've heard, that if there's secondhand smoke in your unit, that you can use air purifiers or like humidifiers to help clean the toxins out. Is that true?
They might make a slight difference, but the only way to completely remove secondhand smoke from an environment is to have a completely smoke-free environment. And many people have tried with air purifiers and even moving smokers to one part of a building as opposed to throughout the building. That might lessen the exposure for some of the people, but it won't remove it altogether.
So for those who are really sensitive to secondhand smoke, are there buildings in Ontario that are smoke-free?
There are some buildings that are going smoke-free. more and more people need to start asking for smoke-free housing, and more landlords need to know that, and housing providers of all kinds, need to know that they can provide smoke-free residences should they want to. You can put a no smoking policy in place if you are a landlord or a condo board or even a housing corporation. And we do know of 70 social and community housing providers in Ontario that have no smoking policies. There's probably much smaller numbers of condo developers, and we wouldn't even know the number of smaller market rate buildings that have no smoking policies, but it's becoming more popular.
It's better than nothing. It's better than nothing. So what if tenants who were sensitive, or who have neighbors who smoke, and secondhand smoke traveled through, and even after confrontation their neighbor still refuses to quit smoking? What are some of the options that tenants can do?
Yeah, there may not be a lot of options. However, there may be. Tenants may want to talk to other tenants in the building. They may want to write a formal letter of complaint to their landlord or their housing provider. There are also housing tenant rights advocate groups that they might want to talk to. Certainly they can make a complaint to us by calling 311 and asking to speak to Toronto Public Health, and
so
we're
make a
tracking
direct
those
call.
complaints.
Yeah.
Yeah, and we can help them with certain steps they can take. It may be a situation where they want to talk to the other residents in the building and the landlord about a no smoking policy. And there may also be things that they can do with their landlord to seal up their unit to try and protect themselves from the smoke coming in. And unfortunately, if none of these tips work, they may have to consider moving to a smoke-free building, and we can also help them try to find that.
Yeah. Is there such thing as, crazy as it sounds, third or fourth hand smoking?
Third-hand smoke exists. I'm not sure about fourth-hand, but third-hand definitely. Third-hand is the solid particulates, or the solid particles that come from the smoke. So after someone's finished smoking, there's lead, and there's toluene, and there's arsenic, and all kinds of lovely chemicals that fall down from the ground and settle onto surfaces and on walls, and it gets into dust. And if you've ever been into a home where a smoker lives and moved a picture off the wall, and you can see the sort of lighter color outline of where the picture is compared to the wall, that's third-hand smoke.
Yeah.
And it's particularly dangerous to little children who are crawling around on the ground or on the carpets and the fabrics, where secondhand or third-hand smoke can last for months and sometimes even years.
Yeah, and it can get on your clothes too, since it's a surface, it's a solid, and the smell stays with your clothes. It stays with your clothes. So I was just wondering, what was the new bylaw debate that was happening in December?
Yes, Council approved the passing of our new no smoking bylaw. It's actually an existing bylaw. We just added some more restrictions to it. So now it is against the law to smoke within 9 meters of any public building entrance or exit in 9
meters.
9 meters. 9 meters. So that's about 30 feet.
Yeah.
And so any building that's accessible to the public, so that could be
a library, any public building.
Any public building, any building. I mean, the grocery store, any cafe or restaurant, arenas, the fancy aquatic center near here. Anywhere that is generally accessible by the public, including multi-unit buildings. So if your building has an open lobby where people can walk in and out, or even a store at the bottom of it, then there's a 9 meter rule there too.
Wow. So what are the charges if you were to be caught less than 9 meters?
Those are still being worked out. So, but you can definitely call us if you want more information, and call 311 or go to toronto.ca/health. And we have lots of information on the bylaw, including signs that building owners can download.
That's great. Is there anything else you would like to add?
Definitely. If you are a smoker and interested in quitting, we would very much like to support you to try to quit. You can go onto our website at www.toronto.ca/health. You can call 311, and you can also go to Smokers Helpline, smokershelpline.ca, and they're an excellent resource for help with quitting smoking.
Thank you, Claire. Thank you so much for joining me on my show today. That is great. You were very informative, and I'm sure the audience got a lot of information, got a lot of facts, and we're very educated about secondhand smoke. Thank you so much. I really appreciate it. Well, that's all for today's show. Again, I'm your host, Vina Vo, and you're watching Tobacco Talk. See you next time.